Hi, and welcome back to my channel. My name is Dr. Hilda, and this channel is just about diabetes and educating people about diabetes and how to prevent complications of the same, and also how to prevent getting diabetes. So today we are going to talk about diabetes. What is diabetes? And I would like at the end of this for you to be able to understand what diabetes is and how it comes about. So to explain this today, I will use an analogy. So let's say you're in the middle of a very remote place. It's your home, you want to build a house there. And the only place where you can get resources at that point is an ATM machine, which is nearby. So you're ready to build your house and you know you have a lot of money in the bank. So when you reach the ATM machine, you get into your pocket and you realize you don't have an ATM card at all. So unfortunately, you're not able to build your house. Now that's the first scenario. The second scenario is you want to build your house, you're still in that remote place, and you go to the ATM machine, and yes, you do have your ATM card, but when you try using it, it just gets jammed. And you try and try and try, and it just gets jammed. After some time, it works, and you're able to withdraw a little amount of money, but it's just not as efficient as before. So in these two scenarios, I want you to see that in one, you did not have an ATM card. So yes, you had a lot of money in the bank and you have the capacity to build a big house, but you can't do it because you don't have an ATM card. In the second one, there was a lot of resistance with the ATM machine, and the ATM card was just not able to be utilized. And in the end, it was utilized, but you just were able to get a little amount of money in. So what I want you to remember in these scenarios is that the same thing applies to diabetes. So in diabetes, you have something called insulin. So insulin is produced by your pancreas, and what insulin does is that it helps your body to store energy. And usually the energy is in form of sugars. So that sugar that comes into your bloodstream is stored through insulin. It is stored in the cells, mostly in the muscle, and sometimes also in the liver and other areas where it can be used later when you need that energy. So what happens with insulin is that, what happens with diabetes is that you do not have enough capacity to store the sugars that are circulating in the bloodstream. So in the first scenario, which we call type 1 diabetes, you do not have insulin, and that's why I was saying in the analogy there's no ATM card. So yes, you do have a lot of sugar running around in the bloodstream. There's a lot of sugar, and you have the capacity to actually build the house, so to speak, which means you have the capacity to store a lot of energy for the body, but you can't do it because there's no ATM card, which means there's no insulin. So you're not able to use the sugars accordingly. Now, the second scenario is type 2 diabetes. Type 2 diabetes, you have resistance to the insulin that's in the body. So the insulin is not able to do the work that it's supposed to do. It cannot store the sugars properly in your muscles and in your liver and other areas because it's not working properly due to insulin resistance. And insulin resistance comes about through things like obesity, things like some syndromes like polycystic ovarian syndrome. Then there's some genetic factors that can make your insulin to just not work properly, even if it was working properly for many years before. The resistance can just be acquired through that. So it's important to realize what kind of diabetes you have, because it also helps us to know how to treat you. For people who do not have insulin, so in the analogy, the ATM card was not there, they need an ATM replacement. And this pretty much means you need insulin replacement, and this is done through injections. So these are the people who use insulin through injections in order to help the body absorb the sugars that it requires for energy. And in the type 2, we usually give medications to help to reduce insulin resistance. But at the same time, it's also very important to do exercise and to improve diet, because weight loss and exercise really go a long way in reducing insulin resistance. So that is diabetes, guys. I hope you have understood. If you have any questions, please comment below and I'll be able to answer your questions in the subsequent videos. Bye!